When I was diagnosed with atrial fibrillation, it was a big shock. I'm used to having injuries, part of our training, particularly as an Olympic athlete, but this is something much more personal. It's a condition, and it's something which can affect you after my rowing as well.
Atrial fibrillation is the commonest abnormal heart rhythm, and it's a situation where the heart, rather than beating regularly, beats irregularly and often faster than normal, so the heart works less efficiently than normal. One of the challenges with atrial fibrillation is that the symptoms can be very subtle, so patients may not recognise the problem when they get it.
I thought I was just ill, had a virus, which the rest of the team had, so I was just very run down. I'd walk up the stairs and I'd be out of breath, go down to the shops. We realised at that point that something was pretty clearly wrong.
One of the problems with atrial fibrillation is that the symptoms are very subtle, so many patients may not recognise that they have a medical condition. When atrial fibrillation isn't treated, it can cause a number of different symptoms, including shortness of breath, palpitations, inability to exercise, or even heart failure in extreme cases. So there are two reasons why it's important to get atrial fibrillation diagnosed and treated early. The first is some patients are at risk of having a stroke as a result of atrial fibrillation, and taking anti-clotting drugs will really significantly reduce that risk of stroke. In the other group of patients who get symptoms from atrial fibrillation, the sooner you treat it, the easier it is to get rid of it. And so for them, getting treatment early can make a big difference to their future prognosis.
Within a day I was diagnosed, I'd been to see specialists, and it was very quickly assessed that it was atrial fibrillation. And then the procedure after that was very quick in making sure that we understood the condition, what the right treatment was. I was probably out of training for a good 4 or 5 weeks, which was pretty significant for Olympic preparation, only 6-7 months before the Olympics. It was a really difficult part of the season, December, just as you finished the winter training and you're just getting into a big selection phase, and that's when I then got diagnosed with atrial fibrillation. But it was absolutely crucial getting that treatment very quickly. Had it been a week later, I'd have missed the next set of trials, and then that would have had a knock-on effect all the way up to the Olympics. So that quick treatment was really, really essential.
So if people have concerns about their heartbeat, the first thing they should do is think about their symptoms. The occasional skipped and missed beat is quite normal, but sustained, fast or irregular beats for no obvious reason is not normal. If you think you've got atrial fibrillation, the first thing to do is to educate yourself. There's lots of online material, and one example is the Bupa online guide to atrial fibrillation. Having that information at your fingertips means that you then, when you go to see a heart rhythm specialist, a consultant with an interest in heart rhythm problems, you're able to ask them appropriate questions and understand all of the treatment options available to you.
Having had atrial fibrillation, I'm fully aware of what you need to know about the condition, so that going forward it's something I can manage. I know how to recognise it, and going to speak to your GP, finding information, educating yourself about it is absolutely key to dealing with the condition long term. The quick treatment meant that I was then able to get back for trials in time, and then on to Olympic trials and getting in the 4 of the top boat. Had that not happened, I wouldn't be a gold medalist again.